Are you waking up several times at night just to use the bathroom? Or do you find yourself constantly rushing to the toilet far more often than your friends or family? At first, it might feel like just a minor inconvenience, something you can ignore or laugh off. But the truth is, frequent urination can be much more than an everyday annoyance. It can interfere with your sleep, drain your energy, and even affect your confidence in social situations. Most importantly, it can be your body's way of sending you a very important message that something deeper may be going on with your health. And that is exactly why paying attention to this symptom is so critical. Many people brush off frequent urination. They tell themselves, maybe I just drank too much water today, or maybe this is just part of getting older. And while sometimes those things are true, the reality is that urinating too often can be much more than just a harmless habit. When you find yourself making bathroom trips every hour or waking up several times at night, it can be a signal that something deeper is happening inside your body. One common cause is urinary tract infections. These infections may start small, but if left untreated, they can spread to the kidneys and cause serious complications. For men, frequent urination is also linked to prostate problems, like enlargement or inflammation, that should not be ignored. Another major factor is diabetes. High blood sugar forces the body to flush out excess glucose through urine, which means you'll feel the urge to go far more often. In fact, frequent urination is one of the earliest red flags of undiagnosed diabetes. An overactive bladder where the bladder muscles contract too often can also be to blame. And in some cases, the cause can even be kidney stones or more serious conditions like bladder cancer. The key message is this: ignoring these signs doesn't make them disappear. Hoping they will go away on their own only delays treatment, and sometimes that delay makes the problem worse, more painful, and harder to manage. Paying attention early could save you from far more serious health issues down the line. A urologist is a medical specialist trained to understand and treat the urinary system, the kidneys, bladder, ureters, and urethra, and for men, the reproductive system, including the prostate and testicles. While many people may first visit their family doctor when they notice frequent urination, a urologist is the doctor who can look deeper with the right tools and knowledge to uncover what's really going on. When you walk into a urologist's office, they don't just ask how often you go to the bathroom. They want the full picture. They ask about your medical history, your lifestyle, your medications, and even your sleep habits. Then they perform targeted exams and order specific tests that can reveal problems a general checkup might miss. For example, they may check for urinary tract infections through lab analysis, measure blood sugar levels to rule out diabetes, or use ultrasound imaging to examine the bladder and prostate. They can even run special flow tests to see how well urine is leaving your body, which can reveal hidden blockages. Consider this. One patient believed his frequent urination was simply because he drank too much tea before bed. But after a proper urologist evaluation, it turned out to be an enlarged prostate putting pressure on his bladder. Without seeing a specialist, he could have ignored it until the condition became much more serious. This is why a urologist plays such a critical role. They don't just guess, they investigate, identify the cause, and guide you toward the right solution. When you see a urologist for frequent urination, one of their main goals is to determine the real cause behind your symptoms. And the truth is, there are several common conditions that could be at play. One of the most frequent causes is a urinary tract infection, UTI. This happens when bacteria enter the urinary system and irritate the bladder, creating a strong urge to urinate even when only a small amount of urine is present. While more common in women, UTIs can affect men as well and need proper treatment to prevent kidney involvement. For men, prostate problems are another leading cause. The prostate gland sits just below the bladder, and when it becomes enlarged, a condition known as benign prostatic hyperplasia, or BPH, it squeezes the urethra and disrupts normal urine flow. This makes men feel like they have to go often, especially at night. Diabetes is another key factor. High blood sugar levels cause the body to get rid of excess glucose through urination, leading to more frequent bathroom trips. Sometimes this is one of the first warning signs of undiagnosed diabetes. An overactive bladder can also be to blame. This condition occurs when the bladder muscles contract involuntarily, creating sudden urges to urinate even if the bladder isn't full. And finally, though less common, urologists must always check for more serious conditions such as kidney stones or bladder cancer, especially if urination is accompanied by pain, fever, or blood in the urine. The bottom line? What seems like a simple symptom, going to the bathroom too often, can have many different causes. Only a urologist can sort through these possibilities and pinpoint what's really happening. Once the urologist identifies the cause of frequent urination, the next step is treatment, and in many cases, the solutions are effective and life-changing. If the problem is a urinary tract infection, a simple course of antibiotics can often clear things up within days. For prostate enlargement, medications that relax the muscles around the bladder or shrink the prostate can bring significant relief. In some cases, small outpatient procedures are available to restore proper urine flow without major surgery. If diabetes is the underlying cause, controlling blood sugar through diet, exercise, and medication becomes essential, not only to reduce urination, but also to protect the entire body. For an overactive bladder, doctors may recommend medications that calm bladder muscles, bladder training exercises, or even nerve stimulation therapies for stubborn cases. Beyond medical treatments, lifestyle changes are equally powerful. Reducing caffeine, alcohol, and carbonated drinks can ease irritation of the bladder. Staying physically active helps maintain healthy weight and improves blood sugar control. Practicing pelvic floor exercises known as Kegels can strengthen the muscles that support bladder function. Even something as simple as adjusting fluid intake, drinking enough during the day but less in the evening, can reduce nighttime trips to the bathroom. What matters most is that frequent urination doesn't have to control your life. With the right combination of medical care and healthy habits, you can take back your comfort, your sleep, and your confidence. The key is not to delay, because the sooner treatment begins, the sooner you'll see results. So if you find yourself running to the bathroom more often than usual, whether it's during the day or waking you up at night, don't ignore it. Frequent urination is not just a harmless inconvenience. It can be your body's way of alerting you to infections, diabetes, prostate conditions, or even more serious health problems. The good news is you don't have to figure it out on your own. A urologist has the expertise to uncover the real cause and guide you toward the right treatment. And with proper care, most people see significant improvement, regaining their sleep, energy, and peace of mind. So take that step. Schedule an appointment, ask the questions, and take control of your health. If this video was helpful, give it a thumbs up, share it with someone who may benefit, and don't forget to subscribe for more health insights and motivating stories. Your health is worth it.